Hello everyone, I'm Azita Arvani of the Arvani Group, Mobile and Wireless Strategy Consultants. We are here at the CTIA show in San Francisco, where I'll be chairing the panel for mobile health devices. And I have here with me one of the panelists on the mobile health panel, which is actually a mobile health veteran, Vivian Funkhouser. She's the principal of Global Healthcare at Motorola Solutions. Vivian, it's always a pleasure to talk to you about
It's
mHealth.
good to see you again, Azita.
Thanks for taking the time. So Vivian, what are some of the areas that you see that you feel optimistic that the mHealth market is moving in the right direction?
In terms of the adoption of barcodes to confirm patient identity, positive patient ID, and then to reduce the risk of a med error where the medication is given to the patient, that has gone leaps and bounds just over the last 36 months. I've been in this business for a number of years, and I remember back in 2003, we always had to ask a hospital if they had a barcode strategy, and typically their pushback was, why do I need a barcode from the grocery store? Today, when I ask nurses, IT directors, C-suite, or even pharmacists, what is your barcode strategy? They have the schedule, they know the timing, they know the gaps, they know where they're going. So we have come a long way in terms of understanding the value of a barcode to confirm patient identity.
That's great. And what are some of the things that you think are not moving as fast or we should really work on to make sure mHealth is moving forward faster?
I really think it's an end-to-end solution in terms of interoperability. While the hospital is doing their thing, home health is doing their thing, long-term care is doing their thing, I think that we really need to think about the National Health Information Network, how we connect the dots, share the patient record, share the electronic medical record, and yet have a secure, safe repository so that those who need to know are able to access from shore to shore. And I don't think that we're really addressing interoperability to the degree that we should be or could be. The HIEs, the Health Information Exchanges, are off to a great start, but I think each time they're getting together, they're reinventing the wheel. And so instead of regionalizing it, we should really nationalize it. And that may take more federal legislation to do.
Great. And what is Motorola doing in making sure that mHealth is moving forward faster?
Well, our philosophy, of course, is mobility in the hands of users. We attempt to maximize whatever that mobility is by packing in as many functionalities as we can into that device to make it a useful tool for the users. We also don't want the mobility to get in the way of patient care. It's truly a complementary. But when we look at mobility as the end goal in the user's hands, we also have to back up and look at the infrastructure that is deployed to support that, whether that be a wireless LAN inside the four walls, a wireless broadband to connect a campus or connect a community, or to connect a bunch of offices, physician offices, for example, or to be able to push information, patient information from the home into the physician's office and back again. We look at also the security of the network through our air defense product. And then in the end, Motorola is known, of course, for communication. And we do look at voice communication as an overarching tool for clinicians to link to one another and to link to their patients.
Great. Vivian, thank you so much. Thank you very much for taking the time and your wonderful insights. We look forward to having you.
Thank you, Azita. It's good to see you again.
Thank you. Thanks very much. I'm Azita Arvani of the Arvani Group. We are a business consulting firm that specializes in helping companies with their mobile and wireless strategies. For more on the discussion that I had with Vivian Funkhouser of Motorola and the rest of our mHealth series, check out arvanigroup.com. Thanks for watching and be well.